This edition of the Impact Podcast is brought to you by ERI. ERI has a mission to protect people, the planet, and your privacy, and is the largest fully integrated IT and electronics asset disposition provider and cybersecurity-focused hardware destruction company in the United States, and maybe even the world. For more information on how ERI can help your business properly dispose of outdated electronic hardware devices, please visit eridirect.com. Welcome to another edition of the Impact Podcast. This is a very special edition of the Impact Podcast because today I have my good friend with us today, Dr. Brent Mulliken. Welcome to the Impact Podcast, Dr. Brent.
Well, thanks for having me.
Lovely to have you today. And you're a world-renowned plastic surgeon with offices in Beverly Hills and in Santa Barbara. But before we get talking about what you do as a plastic surgeon, talk a little bit about your background. You know, you went to Harvard and Yale. That's very well known. But for most people, those are massively aspirational schools, just one or the other. Talk a little bit about growing up and what made you want to become a doctor to start with.
Well, I think it probably started in 6th or 7th grade when we were dissecting pigs. Okay. And a lot of people were fainting and I wasn't fainting. So I figured I had to be a doctor after that. But I just liked the anatomy and everything was kind of pretty to me. Even inside the pig, you see all the organs and how everything works. And it was just this whole machine inside that, you know, was new to me.
Got it. And then so as you were evolving as a teenager and everything, I mean, Harvard's a big swing at the ball. What made you say, I want to go to Harvard?
Well, I never thought I'd get into Harvard. I didn't even think I'd get into medical school. So I just worked harder than anybody else thinking that, you know, this was in the day when it was really hard to get into medical school. Remember the Bakke case?
Yeah, yes.
So he was an older doctor and he got admitted to medical school and, you know, he had to fight it in court. And I remembered seeing a documentary once. Well, it was a sort of a documentary on this, or, you know, a biopic about this blind man who was applying to medical school. Huh. And for some reason, I really bonded to that picture because the blind guy got into medical school was the end of the story. But I remembered his trials and tribulations, and he interviewed everywhere, and they were saying, look, how can we take a blind guy and make him a doctor? So it was just something I never thought I'd really do. So I just worked hard all through high school in Davis, California, got on my bike whenever I could. And then, you know, then I got into some universities and I ended up going to, because we moved to West Lafayette, I ended up going to Purdue University for a couple years. Okay. And I was pretty young, so I graduated when I was 17. I don't recommend that, but I did.
Whoa.
Yeah, 17 from high school, then 19 from college. Oh. So, so then I had to do something with my time. So I went to graduate school at Harvard and studied literature. I was in the graduate school program in literature, in German and English literature. So I spoke German at the time and I loved literature. So, you know, I knew I was probably never going to read a book again once I got into medical school, which is kind of true. I'm sad to say I read very little. My wife gets on me for that, and rightfully so. I should be reading much more.
And then you applied from Harvard to Yale Medical School.
Yes. So then I applied to medical school because I always loved medicine, and literature just wasn't for me. It was too much time in the books and not enough time with patients. So I applied to medical school and I got into Yale Medical School. So that's where I went for 4 years.
So now you have this amazing and very successful practice in Beverly Hills and Santa Barbara. How many years have you been actually practicing as a plastic and reconstructive surgeon?
Well, so after 4 years of medical school, so after college, you go to medical school for 4 years. And then after 10 years of residency, I did that at UCSF. I know it's a long, long time. So be careful what you wish for. But I got into the programs I wanted and UCSF and then UCLA, lots of research and in wound healing. And then I'm in Beverly Hills. So I've been there 25 years, so 25 years in practice since I graduated.
Got it. And for our viewers and our listeners that want to find Dr. Mulliken, you could go to www.drbrent.com, drbrent.com. I'm on your website now. It's a beautiful website. There's a lot of before and after pictures, but they'll also on our website, on the Impact website, along with this show, we're going to be showing a lot of your before and after pictures that aren't even on the website. You know, Doc, one of the things that I'd like to just start with is I've always heard about facelifts. I've always heard about tummy tucks, but is a facelift just a facelift, or a tummy tuck just a tummy tuck? Or are there new innovations that have happened during your 25 years of practice, and how have you helped evolve those innovations in the facelift and the tummy tuck?
Well, when I was a resident, so I was still a resident in training, and I had the very famous professor, and we were doing a facelift together. And I said, Dr. Mathis, boy, you really got this down. And he looked at me and he said, Brent, what I want you to do is in 20 years from now, do everything differently from what we do now. I want you to innovate. I want you to do everything differently. So for example, the facelift we did at the time, there was a high on the side approach. Right. Now we take the skin back in a more normal anatomic direction. We were able to lift the deep tissue, which we really weren't able to do at the time. Especially in this area, the high SMAS. We didn't have laser back then. Now we have laser. We didn't have live fill, which is, grafts that you put in the face. Now we have those. We didn't have hair and nerve steering brow lifts. So now we have those. We didn't have the cheek lifts. We couldn't do anything for the mid face, the area below the eye. And the other day I was looking at the way I did a facelift with Dr. Mathis, which was still a very wonderful procedure. Nothing is the same. Absolutely nothing is the same. Every single thing is different. So then I remembered his words and I thought, he's not around anymore, but I bet you he'd be proud that we do everything differently now.
Yeah, and isn't that a little bit almost opposite of what typical medical schools teach you in terms of you do something one way and you sort of stick to that methodology? He actually encouraged you to innovate, and that sounds a little bit more out of the box than typical medical professionals that I've heard before.
Well, he was an incredible innovator. And he developed many of the flaps that we still use today for reconstructive surgery. And he had the definitive work on how to reconstruct using flaps. So he was a big innovator, huge innovator. And he just taught me, you do everything with the patient's own tissue if you can. There's a way of doing reconstructive surgery where you do the least invasive thing that gets the job done. So all these principles those are kind of the principles you want to learn. Now in medicine, like in any other field, many people finish training and they're very well trained, but they don't keep up. Now, keeping up doesn't mean just you learn what's going on in the meetings and so on. Keeping up, I would say, would be innovating yourself. So if you come up with your own procedures, when you see, look, when I'm doing it this way, it works better, or gosh, there's got to be a solution for this problem. We have to come up with something. For example, for the lower eyelids. So when I got into practice, everyone's lower eyelids didn't look good. They were all pulled down. So I figured, gosh, there's got to be a better way of doing the lower eyelids than just taking skin away and fat and pulling the eyelids down, because everyone looks done. So I saw an operation done at a meeting. It didn't make sense to me, but it was brilliant. It was lifting up the skin below the eye, like a cheek lift. So I went to the anatomy lab at UCLA and I worked on it a little bit on people who didn't care if the result came out or not. Those were cadavers. They never complain. In many respects, they're the best patients of all. Anyway, so that's where I perfected the cheek lift. And I published it, and then things were started. But that's how I think you want to innovate. So
you have many things like that you've innovated over the years. The 360 facelift, the live fill, the natural ear, those are some of the things that you've innovated. Is that not correct?
That's true. So all of these arise from, I'm looking at the facelifts, and a lot of people have their ears pulled down. So you can tell that people have had a facelift, or their sideburns really high, especially in women, but also in men. Or the ear just looks funny, it's pulled forward. It looks like it's windswept or done. So all those things have a mathematical reason that you can look at and you can kind of change around. So that's what happened. And each one of these things where it really bothered me, how it was coming out, how it was looking, you have to come up with something new then.
Interesting. For our listeners and viewers who've just joined us, we've got Dr. Brent Mulliken with us. He's a plastic and reconstructive surgeon with offices in Beverly Hills and Santa Barbara. To find Dr. Brent, go to www.drbrent.com. And doctor is Dr. drbrent.com. Like I said at the beginning of the show, Dr. Brent is not only one of the great plastic and reconstructive surgeons with offices in Beverly Hills and Santa Barbara, but he's also been my friend for about 10 years. And that happened because I had gotten into an accident and actually got a concussion, which actually broke my nose in the process. And I needed 40 or 50 stitches on my face that were put into my face in an emergency room setting. And my friends in Beverly Hills said the best guy who does his faces and does reconstructive surgeries, Dr. Brent Mulliken. They sent me to Dr. Mulliken 10 years ago, and people who meet me or don't know me and they hear about the surgery after he reconstructed my face and fixed all the stitches and rechanged my nose around, they say it's very hard to see all the work that Dr. Brent did, which I think he did a miracle job on my face. And I'm 58 years old and very grateful for all the great work you did, Dr. Brent, on me. And I also got to know you over the years. And I know you don't only just practice for money, which of course we all like to do and make money to feed our families, but you also have a huge charity side, philanthropic side. You created the About Face Surgical Foundation, and also you do volunteer surgery on veterans at the West LA Veterans Hospital. Can you share the philanthropic side of Dr. Brent Mulliken for our listeners and viewers, please?
Yes. So when I do facelifts, that pays the bills,
right.
but it's the reconstructive surgery that I really love.
Yeah.
And that is, when I worked at the VA for 20 years, I did that I'm a professor at UCLA, so my UCLA rotation was to take the residency surgery on the veterans. Now, the residents are super, super busy. They just are working, you've heard about how hard residents work. Well, it's all true.
Wow.
But I get a chance as the attending to talk to the patients. And it's amazing, these veterans, what they've gone through. It's just amazing. You talk to them and they had the stories they have to tell. It's just, you can't imagine as tough of a life as we think we may have had. You just can't imagine what these veterans have done. So I'm honored to have reconstructed some of them. Many of them have war injuries. Many of them have sun-based injuries where they got cancers, from sun. If you're on a Navy ship for year after year after year, and they didn't know about sunscreen in the various wars, or maybe they didn't wear it or whatever, but they have cancers everywhere. So that was a big part, and that's how I really learned reconstructive surgery is operating on, many of the people who came through the wars. So it's very gratifying to do that. My surgical foundation, what I like to find is children or victims of violent crime or accidents, and then I supply the money usually. I'm not very good fundraiser, so I'm the one who funds my charity. But it is nice to see. We had one lady, just a couple of patients. We had one lady, she was a police officer up in Santa Barbara. And no one is going to mess with her now. She has a gun, she has a badge. No one's going to mess with her.
Right.
But when she was a teenager, her boyfriend wanted to have sex with her, and she wouldn't do it. So he bashed her in the face, and he broke her nose, and she had this crooked nose that she had to live with. So she's going all through life. Now she's a tough girl.
Right.
And she deals with people at risk kids. But this nose she just never had it fixed. So she came in to see me, and I said, you're the perfect person for my charity. We're going to do this in my charity. So we did the surgery, and she was very emotional about it. She was very open about it too. It was in the newspapers and everything, but she was, it changed her life. Just changing that nose back. It wasn't just changing the broken nose back to a nose that looked normal. It was revisiting the event that happened that gave her that nose. And every reconstructive surgery that I do, every dog bite, every car accident, there's a story behind it. And often the people are just hiding it within themselves. And it's nice to fix something like that, because you're not only fixing the wound, you're fixing the person underneath it. And you're not completely erasing the memory of the traumatic event that caused it, but you're diminishing it. And that's very nice to see. I had a company president, 300 employees. Nothing for you, I'm sure, Don. You probably have many more than that, but he had about 300.
Okay.
And he wanted me to fix a dog bite scar. So sure, we'll do that under local, no big deal. It wasn't that bad of a scar. So where I'm putting the local in, and I hear this. I said, "Are you okay? You have trouble breathing?" And he, "I don't know what's happening. I'm just very emotional. I don't know what's happening." So he started crying. And I said, "It's totally normal. You've been through a trauma that you just never really vented." So here I am fixing on this titan of industry, fixing a lousy little scar on his forehead. But when he was a kid, it wasn't just a lousy little scar. It was this huge dog that bit him on the nose and on the face. And he was, when you're a kid, it's basically like, might as well be a Tyrannosaurus Rex or a huge monster or something, because that's the way he viewed it. So, every reconstructive surgery I do has a story behind it like that. So that's why it's so gratifying to do this reconstructive surgery. And if I can do it, I benefit much more than the patients I'm doing it. I know that's cliche, but it's totally true. The veterans, I still can tell just days and days and days of story about what they did. About, there's one fellow, he was a sniper in the war. And he had all these confirmed kills. So I asked him, "Gosh, didn't that bother you?" And he said, "Nope." He said, "I'm just doing my job for my country, just same as the other guy. He's doing the job for his country. I'm doing the job for my country." So I didn't lose a wink of sleep over it, because that's just my job, and I did my job. And I've always thought of that story. I really don't know what to think of it. It's just, but that's the way he looked at problems. I wish I could look at problems like that,
right?
Without letting it, because I'd probably be a cardiac surgeon and not a plastic surgeon. So,
it's so great that you work on, not only on people's faces, because faces, we've become such a society of vanity, Doc. And it's even happened in our lifetime. We're about the same age. And, our lifetime with Instagram and Snapchat and all these social media things, looks mean even more than I think they did when we were kids. Not that they didn't mean a lot when we were kids, but faces are so important to people's sanity, well-being, self-worth. And veterans are a group of people, that group that you work on are people that we've typically left behind, American heroes that have protected the great freedom that we all get to share and enjoy in this country. But when they come back home, somehow they've been a group that's been left behind historically. So the fact that you work on them and you donate your time and energy and efforts to help fix their problems, I think is just beyond amazing. And it speaks volumes about your character and who you really are, and not just the Beverly Hills and Santa Barbara plastic surgeon and reconstructive surgeon, but you really give back a lot, and you make an impact on people's life. And that's the real exciting reason that I wanted to have you on the show, not only to just talk about the impact you can make on people's lives that can afford your services, which is huge itself, me included, but also the other work that you do, the philanthropic work that you do, that's so important, that keeps everybody moving here in society and keeps us all moving in the right direction. So I'm really thankful for all the work that you do on the philanthropy side of your life, Doc.
Well, I know you understand. You do a lot of philanthropic work yourself, and I think we both know we get a lot more benefit from our patients,
right?
So than we do for our clients. When we do philanthropic work, it's good to give back, and makes you feel good too.
Doc, we're going to be showing on our website. And like I said, your website has a lot of before and afters. And for our listeners and viewers to find Dr. Brent's website, it's drbrent.com. But on our website as well, we're going to have a link to your before and after pictures. So moving from the face, can you go into a little bit of what you've innovated with live fill and how you use live fill to also make an impact on people's looks and self-worth and reconstruction surgery?
So what is live fill? Live fill is basically a strip of tissue that you take from the patient's own body, and then you put it in places to augment the volume. Now, of course, we can do it for cosmetic reasons, such as, the smile lines or the temporal hollowing, or, the jawline or cheeks, because we get more and more hollow over time. And I do a lot of lip augmentations with live fill too, because it's a very natural feeling. It's the patient's own tissue. It's a better way of doing it, I think, than fat injection. So I've done a couple studies and published them. Now, fat injection, what is that? Fat transfer. Well, you're harvesting fat. You put a syringe, you take a cannula, which is a metal tube, and you, under a vacuum, you pull the fat from the patient, and then you put it in a centrifuge, and you spin it down, then you inject it. Well, that fat has to go through the needle, has to go into the centrifuge, and then it has to go out of the needle again into the patient. So as you would expect, most of those cells are dead. That's the problem with fat injection. Most of the cells are not living by the time you start your procedure. So then you have to exaggerate the amount you put in. And then how do you know what the volume is going to be? Is it going to be the same on both sides? Well, it turns out that I did experiments. You take the fat and then you put it on slides, and I give it to the pathologist. And I said, well, tell me how many are live. So we put a dye in. It only gets into the dead cells. Like if the door's open and the dye gets in, the cell's dead, because the cell with the open door is dead. So it turns out that it's very variable which cells are alive and dead in fat injection. So sometimes you hear people with fat injection say, I'm not happy with the surgery I had because the fat went away. Well, you have dead cells, it's going to go away. Or it was more on the left side than the right. Well, if you have in one single syringe, you can have great variability in which are alive and which aren't alive. So how do you know when you're injecting the fat where the live cells are going and where the dead ones are going? You don't. So it can be different from one side to another. And lumpy. Why is it lumpy? Well, if you have dead things that the body can't take away, it's just going to wall it off. So those are the main complaints with fat injection. So I figured there's got to be a better way. So let's go to the bottom of the abdomen. Let's take strips of tissue. The tissue is fine. Nothing's been done to it. No aspiration, no injection, nothing. It's just a strip of tissue. And we make a pocket, we put it in. That's live fill. And if the graft is sufficiently small and it has a good enough surface area, it's going to live if you put it in a place with good blood supply. So that's the whole premise of live fill. It's no miracle. It's just a graft that you put in. And now I've started to use it for scars. So we had a piece we did once on a model who had terrible scarring on her face. And the scar was depressed and it was disfiguring. Even for a normal person to look at, you would say, wow, that was a big scar. But she had a lot of trouble with her modeling. So turns out if you lift up the scar and revise it, but then you put in the live fill to fill in the lost volume, you'll get a better result. So it's perfect for that. I have people with, hemifacial atrophy. It's a condition where just one side of the face doesn't grow fat. So you have this really strange looking face where one side is super hollow and the other side is normal. Lupus can produce that too, a very hollow, emaciated look. So I've used live fill on those patients to fill in the missing tissue. Those are the reconstructive applications. Of course, lots of cosmetic applications also. But now I'm using live fill, and I'm really excited about this, for breast augmentation.
Really?
So if I'm doing a tummy tuck, right. So at first I put the live fill just above the muscle, but it's all the patient's own tissue and it all lives. And then I put it above and below the muscle. Now it's not like getting a 300 cc implant. It's more like a half a cup. But for patients who, I don't want an implant, do what you can. I just don't want an implant. And I've heard about fat injections. What do you think? And I said, well, let's think about live fill. We can put it in those two planes. There's lots of blood supply there. Now, grafts aren't anything I invented. They've been around forever. Everyone's heard of skin grafts. Skin graft, you take the burn. If someone has a burn injury, you cut it off and you replace it with the patient's own skin. That's how a graft works. Now, a graft works best if the skin graft is nice and healthy. It can't be damaged. So if it's nice and healthy, then it's going to survive. And if the blood supply where the graft is going is good, it's going to survive. So those are all the same premises as I use for the live fill. It's nothing new. It's just a different way of doing it. And the graft that there's a super smart doctor, died now, but he came up with a dermis fat fascial graft. He took the dermis of the skin. Now the dermis of the skin, that's the tough layer of your skin. Very, very inflexible. Also, it needs an incredible amount of fuel to keep it alive. There's all these things going on in the dermis. So I figured, let's not use the dermis. So just the fat and the fascia.
How many years ago did you innovate the live fill?
So that was 20 years ago, and I've been using it ever since then.
So when someone like you innovates that, do you teach that to your students at UCLA, or do other doctors with similar experiences as yours start borrowing that innovation or learning that from you, or how does that work in your profession?
Well, anyone's welcome to use the technique. Mostly it's the UCLA people who have seen me do it, or I teach the residents. So the younger doctors, that I teach at UCLA, they'll have that technique and they'll be able to use it. They can't call it live fill, but they're welcome to use it.
Got it. Doc, I know you've also innovated and you created the hybrid tummy tuck. What does that mean compared to the classic tummy tuck that used to be done in plastic surgery?
Well, the classic tummy tuck is still done. So if you have a ton of extra skin and it's just hanging down there, then the classic tummy tuck is perfect.
Okay.
But what about for all these fit moms? They barely gained weight during their pregnancy. They kept their weight down. They're very fit. Many of them jog or work out, play tennis, ride their bikes. So they go to these doctors, and 99% of doctors will say, well, what you need is a full tummy tuck. So we're going to make this super long incision that's going to go hip to hip. And the women just about drop their jaw saying like, look, I barely need anything. I just have this pooch from my babies. And they say, well, sorry, I can do the mini tuck, which stops at the belly button, or we can do the full tummy tuck and you can have the long scarf. That's what we offer. So I figure there's got to be a better way. So why not use the C-section incision and tighten the whole fascia all the way up and down? The fascia is the lining of the muscle. That's when ladies have babies, there's usually a bulge because you put a basketball in there, you take it out, and God forbid you do it 2 or 3 times, there's going to be some trouble.
Right.
So that's what the hybrid tummy tuck is good for. So it's a smaller incision, it's low down. And now there are all sorts of in-between operations between the full tummy tuck and the hybrid tummy tuck that I use also. Hybrid tummy tucks with a vertical, a full tummy tuck with modified incisions. It all depends on the patient. So it's nice to be able to offer, especially fit moms, this operation where, they can have basically a low incision that involves tightening still the full fascia. So the first time this happened, one of my patients came to me, gorgeous, had 2 kids. She was unbelievably disappointed that her 24-inch waist went to 26. I know, right? Rich people's problem.
Good problem.
Good problem to have, but she didn't like it. She didn't like that bulge.
Wow.
So she said, I want to fix this, and I don't want a full tummy tuck, and I have a C-section scar. So I want you to use the C-section scar and figure out a way to tighten the fascia, and I'll see you Monday. So I was chewing my fingernails. There was a big pile of fingernails on my desk all weekend. So that I told her this hasn't been invented. What am I going to do? So she came in Monday, and I said, I thought about it a little bit and said, well, okay, I'm going to try to tighten this as far as I can. No promises. So I opened the C-section. I tightened all the way up to the belly button, which is when you're looking up in this little tunnel, there, right in the middle, like this, is the belly button. So that's what you see is nothing but a belly button.
Wow.
So you have to get to one side of the belly button and the other side of the belly button. Okay. So I figured a way to open up 2 tunnels, one to the one side and one to the other side. And then I took a stitch on one side and I passed it underneath where the belly button shadowed, and then picked it up from the other side and then passed it backwards and I tied a knot. Okay, that was the first one. I got about 1 inch above the belly button. Let's do another one. I got 2 inches above the belly button. I got 3 inches above the belly button. I got 4 inches above the belly button. Now, luckily, I had this surgical technician who was a bodybuilder. But by the end, he was shaking like this because you had to hold up the surgery the entire time. So he was a big guy, but he was literally shaking like this with his hands because he had to hold up the retractors. So since then, I got some robotic arms that I fitted to my table. They're making them in Switzerland. So I got these robotic arms which lift up things for me. And for a while, I used an endoscope. An endoscope is something where you look in the camera and you're doing the surgery, but you can do it that way also. So Yeah, it's been a fun journey. But the hybrid tummy tuck, people come from all over because they're always fit moms. They've been told by their doctors. So eventually the doctor's gonna get tired of it and start doing the hybrid tummy tuck. But
And there'll be pictures of the before and after of those tummy tucks on the Impact website. And also you can find those same pictures of before and afters on Dr. Brent's website, www.drbrent.com. You talked about people coming from all over. I've been in your office so many times, dozens of times over the years, and there's always people in from all over the world. Doc, do people, when you're at conferences or meeting other great plastic and reconstructive surgeons from different parts of the world and also the country, is what the clients are looking for similar, regardless of region, or are doctors in South Beach doing something different from doctors in Dallas? Are clients in New York asking for something different in Beverly Hills? What do you see on a regional and international basis? Because I've met people and patients of yours from all over the world in your office.
well, every plastic surgeon is different. It's almost like artwork. So one style may not fit all. Like some patients come in, let's say a facelift. Some patients come in and I want my face so tight you can bounce a quarter off it.
Wow.
Well, I'm not your guy. I'm not your guy because it doesn't look natural. And my first premise of every surgery is if it doesn't look natural, I'm just not going to do it. I'm not going to harm the patient.
Right.
The enormous butts, count me out.
Right.
Besides the danger from the surgery, it's not a good look for me. It's not something that I want the patients to have to contend with later when they gain a few pounds and they have this, and then the Kardashian, their influence won't be forever.
Right.
So when that happens and people are walking around with enormous bubble butts, what are they going to do? So I don't want to be the doctor who's created those.
What are people asking for most right now? And Doc, as a secondary question, we're still living during this tragic COVID-19 period. Talk a little bit about the COVID-19 and the weight gain that people are doing, and also what is being called the Zoom boom in the plastic surgery industry. Are you seeing some of that, and will we see more of that in the months and years to come? Because Zoom is going to obviously stay with us, and we're taping this over Zoom today. What are your thoughts on what are they asking for currently, and what does COVID-19 mean to your practice now and beyond?
Well, let's start with the Zoom boom. The Zoom, everyone has to look at their own picture. Yeah. It's not just a glance in the middle in the morning and a glance in the evening, but you're looking at that picture all meeting. And for most people, or for many people, it's sort of a horrifying experience because we all think of ourselves, we work out, we take care of ourselves, we do all this stuff. And yet the person in the Zoom looking back at you, oh, come on, this is a bad joke. It must be the lighting.
Right.
It must be the lighting. Right. And I too, I had my eyes were getting very heavy. And I said, I just had some salt yesterday. Maybe it was a glass of wine I had, but then I realized it's every day. It's not going away. It's me.
Right.
So I had my eyes done and I had them conservatively done. And, but that's the way it is. So Zoom is now it's ubiquitous. All the students are using it and all the business people are using it. Meetings are conducted over Zoom. Now, you mentioned a bunch of things that plastic surgery is used for, the appearance, self-confidence, things like that.
Sure.
But there is a big, big role for beauty and youth as a commodity. It's like money.
Right.
So if you have beauty and you have youth, you come to the meeting with more than if you didn't have that. Now, that's a sad truth of life, but beautiful people get treated better. And young people get treated better than old people. People assume if you're old that you're lazy, you're behind the times, you don't innovate. Well, nothing could be further from the truth with many of my patients. They're just some of the titans of industry and huge innovators, and they have foundations, and they're just the most interesting people. But they're not perceived that way. They have to overcome this ordained thought that they're not worthy of the job or the contract or the whatever. So they look at it as it's just something you do. You got to wash your car and keep it clean, otherwise people think you're a slob. So the same thing with your face. They keep their face up, they do periodic procedures. Now, many of the people in Los Angeles and Hollywood, they're in the business of entertainment. And if you're in the business of entertainment, you're not usually playing your age. You're usually playing under your age.
Right.
So you have to look beautiful. You have to look well taken care of. And that's a necessity. It's not a luxury. It's not, you want to look good for the parties. This is a necessity of business. If you don't look good, if you don't look well taken care of, if you've had bad surgery, you don't work anymore.
It's true.
You don't get a phone call. It doesn't ring. No one will tell you, but the phone won't ring anymore.
Doc, I know you're always thinking, and you're still a young man and have many, many more years to practice. What do you foresee as some of the next trends, not only what the clients are asking for, but from the innovation side of what you're doing? What are you excited about? What gets you out of bed in the morning in terms of innovative plastic surgery and reconstructive methods? And what's going through your mind right now that you can improve upon in the next 5 or 7 years to come?
Well, the biggest innovation right now is in the field of minimally invasive. So things like lasers, radio frequency, therapy, things like that are done through the skin or with minimal invasiveness. Now, I think we have all the devices, of course, and we use them when appropriate. But the companies get a little overboard in hyping what these minimally invasive techniques do. We do all the techniques from Botox and filler to minimally invasive procedures to full-on surgeries.
Okay.
So for me, I like to offer the patient the very best. And I'll say, for your minimal problem on your jawline and a little fat here, let's do some, neck tight with a little wand underneath the skin to tighten and some lipo. Perfect. You're fine. But then for the person who has very, looseness of the muscle, then we want to offer them tightening of that muscle also. So it's not all one shot, one method fits everybody. You have to graduate things and be able to do all of them and offer them all to the patient. So if you're truthful, if I just do minimally invasive, the surgery's bad because, I do minimally invasive. Or likewise, minimally invasive is bad because I just do surgery. Well, if you do everything, then you can offer everyone the right thing.
Interesting.
So minimally invasive is really increasing, but to some extent, it's predatory thinking that is making it so successful. So the doctors, and maybe they believe it, I don't know, but they tell patients, look, you don't have to have a facelift. You can have this device that tightens your skin through the skin or underneath the skin, and it will be just like a facelift. Well, of course it's not. But they've had the procedure once they find that out. So everyone I see now who has a facelift, they've got some threads in, they've had therapy, they've had some, laser lipo to the neck, some tightening, attempts, and now they're $12,000, $15,000 poorer, and they need a facelift, which they need in the first place. And it was predictable they needed it in the first place. So why not tell people, honest truth? I think people appreciate it more if you're honest with them and you tell them this is the best thing for you. This would get you this result, that result, but it won't be the same as the surgery.
Got it.
So that's my thing. But that's definitely the new up and coming area in plastic surgery.
So minimally invasive, using some of the new technologies that exist, that are being invented out there, in combination with some of your other classic surgeries, and giving the options to your patients so they can understand the spectrum of opportunities that they have in front of them.
Well said. Well said. You must have gone to Harvard too.
No, I have not. I am not a Harvard guy at all. But but I've been with you enough. I've been with you enough. I've learned from you how to understand this stuff. That's for sure. So, Doc, I had you on the show because not only you're my good friend, but you really do make a big impact on someone's life. I'm a business person. I do this podcast, and even when you changed my life and made an impact on me by fixing my face after my accident, just normal people have accidents. Accidents are part of life. And they also have tragic other events that happen, as you said, with veterans and other events like that policewoman from up in the Santa Barbara area. So I'm just so grateful for all the important work you do, both on the philanthropy side and also on your day job in Beverly Hills and Santa Barbara. but your work with the About Face Surgical Foundation, working with the veterans in West LA is so important. And I want to give you the last word. For our listeners out there, they can find you at www.drbrent.com. But I want to give you the last word before we have to sign off for today.
Well, I get contacted a lot by people coming up in the medical field, students or even residents, and they want to know, like, what's it like? Being a doctor. So I tell them many of the things that we've talked about today and the interesting stories. Now I can talk all day about this. It's just so interesting. And it's people. Right. You're dealing with people. Right. People with problems. And when you can fix a problem that a person has, there's just nothing more gratifying. It's just I don't know, it's just a great field. And you can never do it well enough. That's the thing about surgery. You can never do it well enough. There's always a better way. And I get to talk personally about you because you've worked on me with great results, and I'm very grateful. My family's very grateful to you. But also I know a lot of other people in LA that sent me to you originally 10 years ago that also sing your praises. And I've met your other patients in your offices, and you just do great work. You're very special. You're not only a brilliant scientist, but also a very talented artist. And I know what you do is both art and science, and that's very unique. And for our listeners out there, again, to find Dr. Brent, go to www.drbrent.com. Doc, thank you for making a positive impact on my life. I encourage all listeners and viewers, if you want to change or make a positive impact in terms of your own looks, go see Dr. Brent. Thanks for making the world a better place, Doc. You're really a special person, and thanks for joining us on the Impact Podcast today. Well, it was my pleasure. This edition of the Impact Podcast is brought to you by the Marketing Masters. The Marketing Masters is a boutique marketing agency offering website development and digital marketing services to small and medium businesses across America. For more information on how they can help you grow your business online, please visit themarketingmasters.com.